Hi, my name is Princy. So I'm gonna make a head to toe assessment video today, and I would like to introduce my client. He's Jigar, and he's gonna be my patient for today. She's Twinkle, and she's gonna be record my whole video. And here is the 360-degree view. Can you hold it, please? Okay. So now I'm gonna start my video. First, I will perform my hand hygiene and provide privacy to the client. Hello, how are you?
I'm good.
Okay, so I'm Princy and I'm a student in Seneca, and I'm gonna perform head to toe assessment today on you by physician order. Is that okay?
Yeah, that's fine.
Okay. So the purpose of this assessment is to get baseline of your overall health, and we can find normal abnormalities, and we can treat for treatment. We can give you treatment further. Okay.
Yeah,
So before we start, would you like to show me your ID band and your name, please,
it's Jigar Darji.
and your birth date?
It's January 29, 1999.
Okay, so the client's details are matched with my records, and I will move further. So I will start from my pain assessment, and I would like to ask you some question, and I will use the PQRSTU method. So do you have any pain in your body?
Yeah, I have back pain.
Okay, so what make it worse or better?
During company time, I have to sit for a long time. It make rust, and in night, I feel good.
Okay, so how would you describe the quality of pain? Is it dull or sharp?
It's dull.
Okay, and on a pain scale 0 to 10, 0 is no pain and 10 is severe pain. How would you rate your pain?
I rate as 4.
Okay, and from how long are you suffering from this pain?
From last 5 to 6 days.
Okay, and does it make any difference to your day-to-day activity?
No.
Okay, so I will inform the physician about your pain, and he will be give you the treatment for that. So my client is well aware about his pain, and now I will proceed further to my neurological assessment. In neurological assessment, I'm gonna check for level of consciousness first. So I would like to ask you some question. Do you know where are you right now?
Yeah, at Seneca Hospital.
Okay, and do you know your full name?
It's Jigar Darji.
And the current year?
2023.
Okay, so my client is awake, alert, and oriented with the time, place, and person. And now I'm gonna check for 3, 4, 6, and 7 cranial. Now, first I will, which is oculomotor, tracheal, abduction, and facial. Now, first I will assess 3, 4, and 6 cranial now, which is used for eye movement. And you just need to follow my finger without moving your head. Okay, and now I will assess for 7 cranial now, which is facial now. Can you raise your eyebrow? Can you close your eyes? Can you puff your cheeks? Can you smile? Can you show me your teeth? Okay, so 3, 4, 6, and 7 cranial nerves are intact. I don't see any abnormality, and client is able to follow my instruction correctly. So now I'm gonna check for Palla. So I'm gonna flash light in your eyes one by one, and just try do not blink. Okay.
Okay.
First I will put in left eye, then right eye. Okay, so the pupillary reflex are bilaterally equal, round, and reacted to my light. Now I'm gonna check for accommodation. So this time you need to focus on that wall, and then try to focus my finger. Okay.
Okay.
Okay, so the accommodation is normal, both eye constricted and accommodated to my finger. So now I'm gonna assess confrontation. So this time you need to cover your one eye and try to guess the number.
1, 1, 2, 1,
Now the another eye.
2, 1, 1, 2.
Okay, so the confrontation is normal, and the peripheral vision is normal and within the range. I don't see any abnormality and no any blind spot detected at this time. So now I'm gonna move further towards my respiratory assessment. So for our video purpose, I'm not uncovering the client, but I will inspect the chest wall, anterior and posterior both the side. So after inspecting the chest wall, I don't see any redness, any bruises, any scar or any mass present at this moment. All looks good. And now I will assess for symmetry, anterior and posterior both the side. Can you breathe normally? Can you turn this side please? So the symmetry is anterior and posterior both the sides are symmetrical, and can you breathe normally? And the work of breathing is also normal. Now I'm gonna auscultate for adventitious sound. I will clean my stethoscope first, and I will auscultate anterior and posterior both the side. For anterior side, I'm gonna check from above the clavicle bone to C6. Now the posterior side, I'm gonna auscultate from C7 to T10. Okay, so I will clean my stethoscope again, and I don't find any adventitious sound, but I found bronchial, vesicular and vesicular sound. The bronchial sound is high in pitch, and the inspiration is greater than its expiration. The bronchial vesicular sound is moderate sound, and the inspiration is equal to its expiration, and the vesicular sound is low pitch sound, and the inspiration is less than the expiration. Now I'm gonna move forward to my cardiac assessment. First, I'm gonna uh, check the heart rate, heart sound of the heart sound. And first, I'm gonna clean my stethoscope first, and then I will place my stethoscope on the right side of the second intercostal space, which is aortic valve, and the pulmonic valve, which is left to second intercostal space, the herb valve, which is third intercostal space, tricuspid valve, which is at the sternal border and fourth intercostal space, and mitral valve, which is at the mid clavicle line and is in the fifth intercostal space. And I will assess apical pulse for 30 seconds. So I will clean my stethoscope again, and I don't find any abnormalities. Plus I heard S1 and S2 sound, which is normal. I don't heard any S3 or S4 or any murmur sound. So all looks good, and all looks good. So now I'm gonna move forward to my abdominal assessment. So for that, you just need to lie down first. So I would like to ask you a few questions.
Okay.
When you had your bowel movement
Today morning,
and urination.
just 2 hours ago.
Okay. So my client has a good pattern of bowel movement and urination, and now I'm gonna inspect the abdominal, but for video purpose I'm not uncovering the client. So I don't see any scar or any lesion or any bruises or any colostomy present at this moment. All looks good. The abdominal is flat, which is good. Now I'm gonna check for condor from both the side. I will check it from my knee level. So from both the side, the condor is bilaterally equal, it's normal. And now I'm gonna check for bowel sound, and I'm gonna clean my stethoscope. I will do from lower right lower quadrant. I will assess every lobe for 30 seconds. Then right upper quadrant, left upper quadrant, and right lower quadrant. So I will clean my stethoscope again, and I heard 5 to 6 bowel sound and bowel gurgle sound, which is normal in range. There is no any abnormality found. And I'm gonna do the same clockwise direction for palpation. When I palpate, if you feel any pain, just let me know. Okay.
Okay.
So right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay, so my client doesn't have any pain, and I don't find any mass or any tenderness present at this moment. So now I'm gonna do my upper and lower extremities and integumentary system. So now I'm gonna inspect first. So I'm gonna check the pain first. So when I'm pressing, if you have any pain, just let me know. Do you feel any pain?
No.
Okay, so my client doesn't have any pain this moment. And I can see that my client is able to move their upper and lower extremities well properly, and the movements are present, so there is no any deformity present at this moment. Now I'm going to check for edema. So my client doesn't have any pitting edema present at this moment. Now I'm going to check for pulse pressure areas. So my client doesn't have any redness or any bruises present at the pressure area at this moment. Now I'm going to check for nails for its consistency. Can you give me your hand? Okay, so the nails are nice and pink, and with normal 5 fingers, which is good. And I can assess for capillary refill. So the capillary refill takes less than 2 seconds for both upper and lower extremities, which is normal. And now I'm gonna check for, now I'm gonna palpate the radial pulse. So the strength is 2+, rhythm is regular, and the rate is normal. I'm gonna auscultate dorsalis pedis. The strength is 2+, rhythm is regular, and rate is normal, and it's bilaterally equal. The posterior tibial, the strength is 2+, rhythm is normal, and rate is equally bilateral. And then I'm gonna check for skin tenderness. So I'm gonna pinch the skin first. So it goes within 2 seconds for both upper and lower extremities. So here I'm done with my head to toe assessment, and then I'm gonna assess for movement. I can see my client is having good movement, and if you feel any sensation, just let me know.
Yeah.
Okay.
Yeah.
So my client had good sensation, and can you hold my hand? Can you squeeze it? Can you push my hand this side? Okay, so my client grip is good, and it's +5. So now I'm done with my head to toe assessment, and here is the 360-degree view. again. So thank you so much for watching. Thank you.